My name is Rachel Fox and I am a haematology nurse specialist in Dublin. This video will walk you through preparation and administration of your Nplate dose. Before you begin, I'd like to remind you of a few important notes on storage and use. First, remember to read all instructions for use thoroughly. It's important to make sure you've stored Nplate correctly. The vial must be kept refrigerated until use. The Nplate vial may be kept at room temperature up to 25 degrees for 24 hours before use. After reconstitution, once Nplate has been dissolved, it should be injected immediately. And finally, remember that you should not reuse any leftover Nplate. Dispose of it as instructed by your healthcare professional.
When you're ready, begin by placing the product preparation and injection reference mat on a flat, well-lit surface, such as a table. This mat will help remind you about everything you need to prepare and inject your Nplate dose. It also provides an easy-to-clean surface for you to work on. To help you be certain of your Nplate dose, your doctor will have written and drawn your correct dose in your self-administration diary. Put your diary, open to this page, next to your preparation mat as a visual aid. You will refer to this page later. Take the Nplate self-injection kit out of the refrigerator. Nplate should never be frozen and should not be used if it has become frozen in your fridge. Check the expiry date on the self-injection kit. If the expiry date has passed, do not use the Nplate vial. Make sure you have all the items you need by setting them up on the mat. Remember, do not open items until directed in the instructions. Do not use any of the equipment that has evidence of tampering or damage, and do not reuse items. This step requires 2 alcohol swab packages, 1 vial, and 1 vial adapter package, which is item E on your preparation mat. Once you have the mat and dose card in place, wash your hands with soap and warm water and dry them. Then, clean the flat work surface with a new alcohol swab. Pick up the product vial, which is item A, and place it in the preparation area of the mat. Holding the vial on the mat, remove the coloured cover from the product vial. Using a new alcohol swab, clean the vial stopper. Do not touch the vial stopper after cleaning it. Leave the product vial standing in its spot while you prepare the vial adapter, which is item E. Peel off the paper backing slowly from the vial adapter while keeping the vial adapter in the plastic packaging. Do not touch the vial stopper or the spike of the vial adapter. Keeping the vial on the mat and keeping the vial adapter in the plastic packaging, line up the spike of the vial adapter to the centre of the stopper of the vial. Push the vial adapter down onto the vial until it is firmly in place and you can't push down any more. Lift off the plastic vial adapter packaging and discard, leaving the vial adapter on the vial. Do not touch the syringe connector. This step uses the pre-filled sterile water syringe, which is item B2, and the plunger rod, which is item B1. Pick up items B1 and B2. Remember, the clear plastic plunger rod must always be attached first before breaking the white tip off the pre-filled water syringe. Perform step 3A before step 3B. Step 3A. Attach the clear plastic plunger rod to the pre-filled sterile water syringe by placing the threaded end of the plunger rod into the syringe and carefully twisting the rod clockwise into the grey syringe plunger until you feel a slight resistance. Do not over-tighten. Next, remove the white plastic cover from the end of the pre-filled syringe. Holding the syringe with one hand, bend the tip of the white plastic cover downward with your other hand. This will break the seal of the white plastic cover. Once the seal is broken, pull the white plastic cover off. You will see grey rubber in the cap. This step uses the pre-filled sterile water syringe and the vial with the vial adapter attached, which is all of the items you've put together so far. Before you begin, please note, do dissolve Nplate slowly and carefully. This is a protein product, and proteins can be easily damaged by improper mixing and excessive shaking. You will now add the water from the pre-filled syringe into the product vial, using the vial adapter that you attached to the vial earlier. Keeping the vial on the table, attach the water-filled syringe to the vial adapter by holding the side of the vial adapter with one hand and twisting the syringe tip clockwise onto the adapter with the other hand until you feel a slight resistance. When the water-filled syringe is firmly attached to the vial, very slowly and gently push down on the plunger rod to inject all the water in the syringe into the vial. Water must flow slowly onto powder. Do not force the water into the vial. Please note, after injecting the water into the vial, it is common for the plunger to move back up. You do not have to maintain pressure on the plunger for the rest of step 4. Before you continue, ensure that all the water is injected from the syringe into the vial before dissolving. Holding the area where the vial and vial adapter connect between your fingers, gently swirl the vial by rotating your wrist until all of the powder has dissolved and the liquid in the vial is clear and colourless. Do gently swirl the vial, but do not shake the vial and do not roll the vial between your palms. Remember, it may take up to 2 minutes for the powder to completely dissolve. Before continuing, visually inspect the dissolved liquid for particles and/or discoloration. It must be clear and colourless and fully dissolved. If there is any colour or particles in the liquid, contact your healthcare professional. Make sure the liquid is fully dissolved before removing the syringe. When Nplate is completely dissolved, remove the empty syringe by twisting it anti-clockwise off of the vial adapter. Discard the empty syringe into a sharps or hazard container. Keep the dissolved Nplate vial. Immediately prepare a new syringe for injection. Do not delay injecting Nplate. This step uses the empty 1 milliliter syringe, which is item C, and the vial of clear dissolved Nplate. Before continuing, check your dose before starting this step. Note that even a small dose of Nplate can have an impact on platelet production, so it is really important that you administer the correct dose. Remove the 1 milliliter syringe from the package. Draw air into the syringe to the 1 milliliter marking. Do not pull the plunger back to more than 1 milliliter. Attach the 1 milliliter syringe to the vial adapter of the dissolved Nplate by twisting the syringe tip clockwise onto the vial adapter until you feel a slight resistance. When the syringe is attached to the vial adapter, push air into the vial. Maintain pressure on the plunger. Turn the vial assembly and syringe upside down so that the vial is directly above the syringe. Withdraw the full amount of liquid into the syringe. The maximum deliverable volume of the 250 microgram vial is 0.5 milliliters, and for the 500 microgram vial is 1 milliliter. Do not pull the plunger out of the back of the syringe. Ensure that the plunger remains in the syringe. Check and remove all air bubbles in the syringe. Gently tap the syringe with your fingers to separate the bubbles from the liquid. Slowly push the plunger up to force the air bubbles out of the syringe. Slowly push back on the plunger to fill the syringe to the amount prescribed by your healthcare professional. Make sure the top of the plunger head lines up with the syringe marking that matches your prescribed dose. If necessary, push liquid back into the vial to achieve the desired dose. Do a final check to ensure the correct amount of liquid for your dose is in the syringe and all air bubbles have been removed. Before continuing, do make sure the correct amount of liquid for your dose remains in the syringe. Once all air bubbles are removed and the syringe is filled with your correct dose, twist off the syringe from the vial adapter. Keep the filled syringe in your hand and do not touch the syringe tip. Do not set the filled syringe down after removing it from the vial. This step uses the filled syringe with the measured Nplate dose and the safety needle, which is item D. Holding the syringe in the palm of your hand with the tip facing up, remove the safety needle from the package. Attach the safety needle to the filled syringe. Apply strong force while twisting to attach the safety needle onto the syringe. Turn clockwise to lock the syringe into the luer lock tip. The product is now ready for injection. Immediately continue to step 7. Select your injection site. 3 recommended injection sites for Nplate include front of the middle thighs, abdomen, except for the 5 centimetre area right around the navel, and if someone else is giving you the injection, they can also use the outer area of the upper arms. Do rotate the site for each injection. Remember, do not inject into areas where the skin is tender, bruised and hard. Do not inject into areas with scars or stretch marks. Wipe the site where Nplate is to be injected with an alcohol swab, using a circular motion. Do not touch this area again before giving the injection. This step uses the filled syringe and needle assembly. Pull back on the pink safety cover, toward the syringe and away from the needle. Remove the clear needle shield by holding the syringe in one hand and carefully pulling the shield straight off with the other hand. With one hand, gently pinch the cleaned area of skin and hold it firmly. With the other hand, hold the syringe, like a pencil, at a 45-degree angle to the skin. With a short, sharp motion, push the needle into the skin. Inject the correct dose subcutaneously as prescribed by your doctor and instructed by your healthcare professional. When the syringe is empty, pull the needle out of the skin, being careful to keep it at the same angle as inserted. There may be a little bleeding at the injection site. You can press a cotton ball or gauze over the injection site for 10 seconds. Do not rub the injection site. If needed, you may cover the injection site with a plaster. After injecting, use your thumb or the tip of your finger to activate the pink safety cover by pushing the cover forward, using the same hand, until you hear and/or feel it click and lock into place over the needle. Visually confirm that the needle tip is covered. Always cover the needle with the pink safety cover before disposal. Immediately discard the syringe with the covered needle into a sharps container. Immediately discard the used Nplate vial into a sharps or hazard container. Make sure all the other materials are discarded into proper containers. The injection device and the Nplate vial must never be reused for another injection. If your dose requires you to use 2 vials, Then set the mat up again with all new materials and follow the instructions for preparing and injecting the Nplate correctly. If you don't need any more Nplate, then you're done for the week.